to assist the technician in ensuring that the final prostheses appear the same, even when supported by different substrates, such as in this case, where adjacent implant and tooth-supported crowns are being made. The clinician uses a shade guide to convey information on color, but the gold standard for shade matching is the technician-acquired shade. Dental technicians are well trained and equipped to match shades accurately, and they will use the shade guides and techniques that will be most useful for them. Technicians may take their own photographs, or they may draw shade diagrams outlining various colors, potential porcelains, and stains for fabrication of the definitive prosthesis. Direct consultation between the technician and patient also provides the opportunity for patients to express their own thoughts and feelings to the technician, and for the technician to derive important information about the case. Technicians can also provide valuable input to educate patients about potential prosthetic outcomes by demonstrating various aspects of their existing condition or by outlining potential problematic aspects that require attention. The most important piece of information in communicating with the dental lab is the technical prescription. Just as a prescription for a pharmaceutical agent outlines the drug, dosage, delivery method, and frequency, this document outlines the basic information required for the technician to fabricate the intended prosthesis. The following minimum criteria should be specified: prosthesis type, materials, fabrication method, retention method, the components to be used, such as abutment types, shade, stage of fabrication. More complex cases may require various stages to be checked clinically. If these try-in steps are performed, it's important to relay the results to the technician. These steps may involve diagnostic wax-ups to assess prosthetic contours, metal framework try-ins to verify passive fit, and biscuit try-ins to confirm base shade, contours, and occlusion. In addition to the prescription, further information pertaining to the case may be helpful to the technician, and a variety of methods are available to communicate this information. While photographs are particularly useful for delivering large amounts of information quickly, diagrams can also help to highlight pertinent aspects of the case. They can succinctly illustrate the clinician's proposed or envisioned prosthesis. The use of an annotated diagram also allows the technician to give feedback and to ask questions about the proposed prosthetic design. Annotated photographs made with presentation software such as PowerPoint or Keynote are another helpful way of communicating with the technician. The use of such software allows for collaboration between clinician and technician, as both parties make further notes or annotations to create together a picture of the proposed prosthesis. Annotated photographs of clinical situations can also provide valuable information to technicians that would otherwise be difficult or impossible to convey. For example, these images convey to the technician the quantity of enamel that is available for bonding of veneers, as evidenced by the frosted pattern produced by enamel etching. This information will be otherwise unknown if the technician were only provided with an impression or model of the clinical situation. Another tool for communication between the lab and clinic is the use of photo editing software to digitally alter and manipulate images. Changes to form, outline, color, and transparency can be used to show various treatment stages and their outcomes in both the lab and clinic. This case illustrates the use of digital manipulation to change the opacity of a wax-up. By revealing the underlying contours of the ridge, the degree of soft tissue modification that may be required can be predicted. The information described in the previous slides is digital. Therefore, both clinician and technician must be able to manage and transfer the appropriate digital file formats for images, presentations, and CAD/CAM designs. Images may need to be compressed to allow easier transfer for sharing of files. Many modern digital cameras, especially full-frame digital SLRs, will generate file sizes of 10 MB or more per image, which makes the sharing of original-sized files cumbersome and time-consuming. Easy-to-use compression software is highly advantageous for rapid sharing of image files. The ideal compression software can produce clear images with minimal reduction in visual quality, known as lossless compression. However, it's important to note that original format or RAW files may be required for presentation, publication, or medico-legal purposes, and therefore RAW files should be preserved or digitally archived. Once the data file has been acquired, the final consideration is how this digital information should be shared between the lab and clinic. Email is a simple way to transfer files between parties. Although email is a rudimentary method, it has several advantages. Email offers the possibility of end-to-end encryption, thus ensuring data security and patient privacy. Email also has the ability to track correspondence in a conversational context for a particular case. However, a disadvantage of email communication is the single-point, one-way nature of data delivery. Sharing information on a cloud-based platform allows multiple users to access the information at any time. Either party can make changes as required, and the files are updated immediately. Again, the protection of patient-identified data is paramount, and it's important to comply with local regulations relating to the storage and sharing of health data. The ITI Case Cloud is a useful tool for the storage and sharing of case information. The Case Cloud allows users to upload images, which can be grouped into individual cases. These images can also be captioned and arranged into discrete presentations, which can then be shared publicly. Cases can also be shared privately to selected users who may access the chosen case for viewing, commenting, or editing. The Case Cloud allows the user to link their clinical cases to educational content within the ITI Online Academy by tagging relevant keywords within the presentation. The ITI Case Cloud removes barriers to case information. By acting as a central silo of information, it allows full-time access for nominated users without waiting across time zones or alerting users separately via emails or other updates. It may be both prudent and helpful to gain the technician's input in the selection of appropriate components for any particular case, as in this case, where angulation correction may be required. However, the selection of implant components is ultimately the clinician's responsibility. Clinicians may sometimes wish to delegate this task to the laboratory, but it's the clinician's duty to know which components have been used in the fabrication of their patient's prosthesis. In some jurisdictions, technicians bear no legal responsibility for the outcomes of dental prostheses once they've been inserted by a clinician, as the quality of the prosthesis should be verified by the clinician. For this reason, implant replicas should be provided separately from the impression, or if in doubt, the master model poured in the clinic and sent to the technician. The attachment of implant replicas into impressions prior to transportation should be avoided, as this creates an extended lever arm with increased potential for tearing or distortion of the impression if the coping moves within the impression past the elastic limit of the material. An important factor in component selection is the use of genuine products. With a myriad of dental implant manufacturers in the marketplace today, it's easy for clinicians and technicians to employ the use of non-genuine components, and it's ultimately the clinician's responsibility to ensure the use of genuine products. Non-genuine components display lower tolerances of fit, as shown in these images of a genuine abutment and screw, as opposed to a non-genuine abutment and screw, both seated on a Straumann tissue-level implant. Larger dead spaces and smaller areas of contact can be seen for the non-genuine products. The use of non-genuine components for prostheses will, in most cases, void the warranty of the implant provided by the implant manufacturer. In all cases, ensure that there is a record of all components used, either provided by the clinician or ordered by the technician for laboratory use. The packaging should be cited and part and lot numbers recorded into the patient's records. Information for laboratory communication, key learning points. Quality photographic images taken with calibration tools allow the technician to fabricate a prosthesis that closely matches the existing dentition. A shade consultation between clinician and technician is considered the gold standard for shade matching. The laboratory prescription outlines the basic information for fabrication of the prosthesis, such as material, method of retention, components, and shade. Annotated diagrams, annotated photographs, and photo editing all improve the collaboration between clinician and technician. Patient information in digital files must be transferred between parties in a secure manner, either via email or on a cloud-based platform, such as the ITI Case Cloud. The selection and use of genuine components, such as abutments and screws, are the responsibility of the clinician. When technical work is returned from the lab, the following basic questions should be answered. Has the technician provided the prescribed prosthesis, such as a direct-to-implant, screw-retained porcelain fused to gold crown? Have genuine components been used, and is there evidence of such? If not, for what reason? Is the prosthesis clinically acceptable in all parameters? In this case, the technician has cemented the prosthesis onto the abutment, but areas of opening are evident at the margin. These were identified to the technician. Finally, is the prosthesis cleansable by the patient? Areas of concavity under a pontic are not appropriately contoured for mechanical cleansing and can trap debris and bacteria. Use of a structured checklist can be beneficial. A checklist of relevant criteria such as fit, aesthetics, contacts, and occlusion provides a qualitative analysis of the laboratory work. This step also serves to ensure that the correct components are present, and it prepares the clinician for the insertion procedure. For example, a checklist helps to ensure that the correct screws are present and ready for insertion. Studies have shown that the use of a checklist can result in improved quality of technical work and improved clinical outcomes. More information can be found in the ITI Online Academy Learning module, Protocol for Fixed Implant Supported Prostheses Delivery. Finally, the use of formal and informal bilateral feedback promotes the teamwork approach between clinician and technician. Providing the opportunity for the lab to give feedback also allows clinicians to improve the quality of their work. Similarly, the technician can provide valuable information pertaining to the delivery of the prosthesis, such as path of insertion or order of seating. Quality assessment, key learning points. All work returned from the lab should be carefully evaluated to ensure that it fulfills the prescription and is clinically acceptable. A structured checklist can be helpful in the evaluation process. Feedback from the technician can assist in the insertion of the prosthesis. Selecting and communicating with a dental laboratory, module summary. The dental technician is a partner in the delivery of high-quality dental implant treatment. Ability to coordinate workflows, financial policies, and expertise with the clinician's preferred implant systems and materials are key considerations when selecting a dental lab. It's also important to consider a laboratory's stance on the use of genuine components and its relationship with third-party providers, such as CAD/CAM centers. The technical prescription forms the basis of communication with the lab. Detailed photographs and a patient-technician shade consultation are recommended supplements to the prescription. Other helpful communication tools include annotated or edited photographs and diagrams. Software and digital file sharing greatly facilitate communication using these methods. Secure transfer of digital files containing patient data is paramount. The quality and accuracy of an inserted prosthesis is ultimately the responsibility of the clinician.